Hi, everybody. My name's Kira Bowen, and today I'm going to give a presentation on vocal hygiene for athletes and coaches. So first of all, I'm going to do a short summary of the topics. So I'm going to cover voice disorders, so the definition, symptoms, and prevention, vocal hygiene, the definition, symptoms, and the good and bad habits we have, why it's important for general public, coaches, and athletes, a little bit of a description about phonotrauma and how that relates to vocal hygiene, and then phonotrauma in sports, and then how to avoid all of that, and then a little bit of resources just to help out later with some information. So first of all, voice disorders, according to ASHA, is something that occurs when voice quality, pitch, and loudness differ or are inappropriate for individuals' age, gender, culture, background, or geographic location. So simplified, a voice disorder is just an issue caused by problems within or on the vocal cords. So there are a few different types of ways that our voice can be impacted to cause a voice disorder. Some symptoms include hoarseness, abnormal pitch, aphonia, breathiness, frequent coughing, or running out of breath. This does not address all the possible symptoms of voice disorder, but those are some of the most common. For the topic of vocal hygiene, our primary focus is going to be on hoarseness, abnormal pitch caused by vocal strain, and aphonia, which is also known as loss of voice. So, a couple of things we can do to prevent voice disorders is basically just start taking care of ourselves, right? So, there are abnormalities like laryngeal cancers, laryngeal webs, spasmodic dysphonia, and vocal fold paralysis, but those are fairly preventable. So, common voice disorders that are preventable include polyps, nodules, and laryngitis. Often, when people misuse their voice, they unknowingly cause strain and damage to their vocal cords. One way to prevent certain types of voice disorders is by maintaining healthy vocal habits. So, vocal hygiene, as a definition, is when one takes care of themselves and starts noticing the factors that affect their voice and making sure that they sustain those habits. So, to be more specific, it involves recognizing improper vocal behavior and the negative impact it has on our phonation apparatus. So, removing symptoms or correcting forms of behavior that have little negative impact on our voice as possible is very important. And correcting working conditions that make normal phonation difficult and cause voice strain is also going to be a huge part in vocal hygiene. So, simplified, it's just individuals taking care of their vocal cords. Just like going to the gym to take care of our muscles, putting on lotion for dry skin, or doing any other healthy day-to-day habits, there are things we can do to have healthy speech, but oftentimes it goes overlooked because speech is not considered essential for comfort of day-to-day living. We notice when our voices are gone, but often it's due to sickness, so we don't really think so much about that as much as we think about getting healthy from our sickness. So now we understand a little bit of what vocal hygiene is. What are some habits that we can have? So, a couple bad habits. First of all, coughing and clearing your throat. Very, very common for most people, right? Whether it's habitual or you constantly have postnasal drip. This includes vocal fatigue and overuse, which is yelling, excessive talking, and whispering, essentially because it's slamming your vocal cords together. Alcohol, caffeine, dehydration, any type of smoking, including vapes, cigarettes, cigars, and marijuana, chewing tobacco, lack of sleep, poor nutrition, and obesity, and allergies are all bad habits for vocal hygiene, though some of these can't necessarily be helped. So, and a little bit of an explanation. Basically, coughing and vocal overuse put strain on your vocal cords, so it's like going to the gym over and over and over again until your muscles are exhausted. Caffeine and alcohol are both diuretics, which means they cause dehydration, so it's very hard to get proper lubrication in your vocal cords. Smoking and chewing tobacco can cause cancers in the mouth, larynx, and lungs, which are all essential for breathing and articulation. Lack of sleep and poor nutrition prevent your body from recovering and hinder your body's natural healing processes. Obesity can cause issues with breast support because your body is not used to sustaining that amount of muscle needed for expiration. And allergies, much night sickness can cause inflammation of the vocal cords, postnasal drip, coughing, sneezing, and sinus infections, which can later affect articulation and then get overcompensated by more strain in your vocal cords. So, now a couple of good habits. Without realizing it, many people do have very healthy vocal hygiene habits, so we don't really have to strain too much to change a bunch of our day-to-day living. Drinking plenty of water, getting quality sleep, avoiding smoking and caffeine intake, and just staying healthy in general are some of the most common habits for individuals, even if we have an off day where we kind of just regress back into old habits like drinking too much caffeine, which we'll talk about later. So actually, one article mentions that typical recommendations for water intake are approximately 6 to 8 8-ounce glasses of water a day. Increased water intake is recommended because there's a growing body of evidence that indicates that vocal fold swelling and the size of vocal fold lesions, such as vocal nodules, are reduced with increased hydration. So basically, keeping your vocal cords well lubricated. So, why it's important for the general public. Essentially, it's just maintaining comfort for speech, which translates to convenience, right? It's really hard to talk to your friends on the phone if you can't speak to them. However, issues like sickness can cause us to lose our voice as our vocal cords swell up from being irritated by coughing and sneezing or postnasal drip. Excessive talking can strain our vocal cords and sometimes cause voice loss, again referred to as aphonia. You're going to hear that a couple times in this presentation. There are types of inconveniences that are very common for most people and are few and far between, but what about vocal health issues under more extreme circumstances? So this is where we get to talking about our athletes and coaches. So for high school athletes, they have some of the largest demographic of professional voice users that aren't considered professional voice users, like singers, preachers, things like that, right? So when you're yelling on a quarter field or you're cheering for your teammates from the sidelines or you go to support your own school at games, athletes are constantly straining their vocal cords. One study shows that 71.3% of athletes had varying degrees of dysphonia, which is another type of voice loss or vocal inflections, ranging from mild to severe, and impaired voice quality. High background noise can cause short-term vocal trauma that can result in more severe functional disorders. So, because athletes are placed under such great tension, we struggle to basically maintain this healthy lifestyle that we're kind of hoping for and have really good vocal habits, right? So one of the studies indicate that they are considered a high risk group of professional voice users. So as any athlete knows, it's not easy to communicate with your teammates or coaches or officials if you don't have a voice, right? So both on and off the court, even if you're asking coaches questions or you're at an event with hundreds of other athletes, and that's not even counting fans, your voice can get drowned out in the noise and you're at risk for causing further vocal irritation. Coaches, it's the exact same thing. We also experience tremendous vocal strain every single season. I say this coming from somebody that coaches for a living. Talking to athletes over the sound of events going on is the equivalent of yelling almost every single day or for as long as we're at the sporting event, right? So one study shows that the prevalence of voice problems, especially among soccer coaches, was really high. In total, 28.4% of participants reported two or more frequently occurring vocal symptoms, most common symptoms being throat clearing or coughing, followed by the voice becoming low or hoarse, which, as mentioned before, just continues to put further stress on our vocal cords. So, any coach with seasons of experience, as most of my participants know who are coaches and athletes, they know how tiring it can be to coach in the chaotic environment of sporting events. Even at practice, a coach is communicating with multiple athletes at once, often in a raised voice so that everyone can hear them and execute practice plans well and efficiently. If a coach doesn't have a voice, communication becomes a struggle, similar to how the athletes are struggling at events, right? So athletes and officials might have a very difficult time understanding, which can cause issues during games or frustrating practices. So what happens if we don't take care of our vocal cords? That's where we start talking about phonotrauma. So according to Depends on Hoffman, phototrauma is defined as the behavior that's contributed to laryngeal and vocal fold tissue injury, inflammation, or other forms of damage. So initially, phonotrauma was called vocal abuse or vocal misuse, but due to the negative connotations related to abuse and misuse, it's been relabeled to be less blame-oriented. Most individuals don't realize they're causing damage to their vocal cords, or they might not even realize what they're doing could set up potential problems in the future. So trying to take that blame off of them and start putting it on the trauma aspect is very important for really good clinical practice. So how does this term apply to sports? Essentially, phonotrauma can compound for athletes and coaches. Most athletes and coaches are reluctant to miss even one practice or game if they're sick, which affects so much more than their voice. That's not just sickness, right? So skipping practice and games for a lost voice isn't really an accepted justification. Take it as somebody who played sports for 9 years. Take it from the rest of the coaches sitting here. They can all tell you that if you lost your voice, you show up to practice and you still want to be there for your team. That means that over time, issues can get worse or develop into something more severe than just a scratchy voice. So essentially, when the strain becomes too much, it can cause damage to their vocal cords, also known as phonotrauma, and this can come in various forms such as aphonia, vocal cord inflammation, or vocal nodules and polyps. Over on the other side of the screen, there's actually an image of what a vocal polyp looks like as it develops on your vocal cords. So a vocal polyp is just a blood lesion that basically is like a blister, and it'll expand and expand and expand and cause really, really painful friction as you speak and phonate. So, because of that, it might mean it might take a while for a coach or athlete to recover to 100%, which still could cause these potential issues. So, how do we avoid phonotrauma? So, for the general public, again, avoiding phonotrauma's severe consequences is just basically maintaining healthy vocal hygiene habits, right? Part of our everyday life. So, avoiding yelling, smoking, and alcohol are some of the things that we can do to keep our voices and our bodies healthy. For athletes and coaches, this is a little bit more difficult. Most sports have a 4-day week minimum for practices and competitive events, which don't give coaches and athletes time to rest their voices. This constant strain, as said before, can lead to lost voices and fatigued voices that never get the chance to properly recover. Again, back to the muscle strain, right? You go to the gym all day, you come home, you're sore, and it's really, really hard for you to recover if you don't take that time to rest. Same thing. Additionally, there are some very common habits that we begin to develop during a sports season that are not beneficial to healthy vocal hygiene. Unfortunately, caffeine is one of them. So, anyone who's participated in sporting events knows that there's a lot of habits that we start to develop to stay sane during a season, right? Excessive consumption of energy drinks really dehydrates you. A messed up sleep schedule caused by late night practices and early morning school prevents athletes and coaches from being fully healthy. Constantly using high energy at practices and events can lead to sickness because we never get a chance to recover. Yelling and loud communication puts strain on our vocal cords, and not drinking enough water to make up for the amount of energy and sweat being expended is also another really difficult thing, which goes back to the energy drink consumption. A lot of times, athletes are more likely to reach for that energy drink for the quick boost to get through the rest of the game rather than our water, which continues to dehydrate them and cause more vocal pressure. So, a couple ways to avoid phototrauma are to remove the bad habits that begin to form before the season starts. In order to be healthy or unhealthy, and just make sure that we're kind of have a healthy balance between the two, because obviously we can't always get our 10 hours of sleep a day. We can avoid caffeine consumption, excessive amounts. We can get a constant good night's sleep, which, according to guidelines, teens ages 13 to 18, which is high school athletes, should be getting between 8 to 10 hours of sleep every night. And that's just for the average person, right? That's not even considering how much more energy these athletes are expending. So, resting after practices and events and avoiding loud communication, as well as drinking plenty of water and using electrolytes to stay hydrated, are going to really help us avoid further issues possibly related to phonotrauma. So, here's a couple resources. As I've seen in your handouts, there's a couple different references on there for articles that even coaches and athletes can go take home. So, one of them is how much sleep do student athletes need? This is really, really important, especially talking to some of your girls who might like staying up for late night practices or some of your boys who are in like a basketball program. Going home and getting that rest is really beneficial. Next up is just taking care of your voice, right? How can we take care of something that's very, very important to everyday living? There's another thing called 10 do's and don'ts for maintaining good vocal health. It's going to talk a lot about caffeine and sleep and hydration. Top 5 mistakes vocal athletes make and how to avoid them also comes down to just communication, learning how to communicate with your teammates without yelling or screaming, that type of stuff. And then coffee and vocal health, which is kind of an experimental study that explores the impact that coffee has on your voice. Excuse that. All right, so in summary, we talked about voice disorders, vocal hygiene, why it's important, phonotrauma in sports, avoiding it, and resources. So last, questions. Does anybody have any?
What is the recommended therapy or treatment for phonotrauma?
So basically, it's just a lot of rest. If you're talking about polyps or nodules, oftentimes you just need to go to voice therapy to start learning a little bit of, again, vocal hygiene habits, right? So that is going in and practicing speech therapy, maybe to alleviate some of that really high pressure friction. Polyps specifically, because they are technically blisters, can be reduced with surgery, but oftentimes we want to try to do vocal therapy first. So phonotrauma is really going to be reduced by hydration and just resting. Same thing as if you're sick.
So I coach volleyball, and we definitely encourage lots of cheering and yelling to communicate on the court and off the court. What would you recommend that they do in place of the loud cheering?
So even just taking a break, or because you have multiple people, it doesn't have to be high screaming, right? So that's one thing that I say as a coach is I don't like hearing screaming. So yelling and talking at a like raised volume, like I'm currently talking at an elevated volume so I can project, but I'm not yelling, right? But if you have multiple people doing that, the sound is amplified, so it actually will save them a lot of vocal strain. Granted, that being said, you are at a sporting event, so it is expected that you're going to go there and cheer and work really hard. So afterwards, it's super important that you don't go home and continue that, right? You're going to be at a sporting event for anywhere between, we'll say, an hour to 7 hours, depending on if you're doing a singular game or a tournament. So basically, taking the time just to recover and rest is going to be really, really important for those athletes.